So, hello, assalamu alaikum, and good morning, everyone. So, I am Yashema Masukat, the second presenter of the Group 7. So, now we will be discussing about the case of JJ. So, the first is the Substance Abuse Mental Health Services Administration o yung tinatawag nating SAMHSA 2014. So, they are conceptualized trauma in three potential ways called the 3 ES. So, they are events, also the experiences, and effect. So, the following is a case study that presents a clinician's work with a client who has experienced persistent trauma in childhood, adolescence, and early young adulthood to the point that where he was hospitalized for psychosis after an arrest for stealing a car and assaulting a police officer. So this case study considers the client traumatic experiences and resulting effects as a key framework for the use of narrative therapy in dealing with the client's history of complex trauma experiences that self-loathing identity and with a recent diagnosis of PTSD with psychotic pictures. So dito, alam naman natin no na tawag dito kung ano ang PTSD. Yan yung tinatawag nating post-traumatic stress disorder. And then, when we say psychotic pictures, naman, ito yung delusional or like naghahallucinations ang isang tao. So, dito as a clinician, you should create a therapeutic environment para ma-feel ni client na safe siya dito at kailangan talaga natin i-feel kay client na safe sila so that maging comfortable sila sa atin, and also in that way mai-engage natin si client na mag-open up sa atin ng kanyang mga naranasan sa buhay. So the next is the number 1. JJ is a 20-year-old male whose parents are white and African American. JJ presented with a significant history of early childhood adverse events. Since he was about 3 years old, JJ recalls a history of physical abuse, domestic violence in the home, persistent juvenile arrest for delinquent behaviors, past history of suicide attempts, dropping out of school at age of 13, and past substance use, although he stopped using drugs at age 17 after a friend overdosed from heroin. So JJ reported being brutally beaten by gang members to the point that he thought he was going to die, and also reported a history of being removed from the home at least 3 times, and that each time he was returned back to his abusive parents, and also he was age 7 when he was first attempted suicide. So JJ tells the story of seeing a lot of community violence, including seeing dead bodies as an almost daily occurrence in his community due to gun violence. So this caused him to open fear for his life. So guys, imaginein natin how hard yung pinagdadaanan niya na sa murang edad na experience na niya ang physical abuse, domestic violence sa sarili niya mismong mga magulang or sa tahanan niya, and also attempt to suicide. So and then naranasan din niyang ma-drop out sa school sa edad na 13 anyos pa lamang, at naranasan din niyang gumamit ng pinagbabawal na gamot. Sorry sa term. Okay. Naranasan din niyang bugbugin ng mga gangsters at akala niya katapusan na ng kanyang buhay. At sinabi rin niya sa 3 beses na siyang beses na siyang pinalayas sa kanyang abusadong magulang. And then JJ tells the story of seeing a lot of community violence, kasama na ang mga makita niya ang mga dead bodies o yung mga bangkay due to gun violence, at dahil dyan, nagdulot ito ng madalas na takot sa kanyang buhay. So, next is the client had just turned age 20 at the time he started therapeutic work with his therapist. He had been kicked out of the home of his mother for the 5th time in 3 times for violence outbursts and was coach surfing, staying with different friends for a few days at a time. So to avoid having to live on the streets, he reported a recent breakup with a girlfriend about a week prior to attempting to steal a car. During the attempted theft of the car, the client was involved in an altercation with the police, faced going back to jail not only for fighting with the police officer, but as a result of this altercation, he has violated his provision for a past domestic charge related to a fight with his mother. So, dito, si client, nung nag-20 na siya at that time, nag-start na siyang therapeutic work together with his therapist, at dito, na-kick out ulit siya sa bahay ng kanyang mother na pang-5 beses na. So, dahil pinalayas ulit siya, ginawa na lang niya is kung kani-kanino siya nakistay sa mga friend niya para lang ma-avoid niya tumira sa streets or upang maiwasan niyang manirahan sa lansangan. So, sinabi rin niya na kamakailan lang naghiwalay sila ng kanyang kasintahan. So, bago pa man siya magnakaw ng kotse. So, sa puntong ito, parang halo-halo na yung mga emotions niya. So, dito, ang rules kasi is kapag ang individual nag-violate ng kanyang provision or violate their provisions, they can face serious consequences including revocation of probation and being required to serve the original sentence. So, probation kasi yan yung tinatawag natin pansamantalang laya under supervision. Correct me if I'm wrong kasi hindi naman po tayo abogado. Okay, so move forward. So, the next is the over the course of 10 sessions with the client reported hearing voices since age 11. He indicated that the voices often told him that he was worthless, ugly, dumb, didn't deserve to live, and that no one would ever love him. So JJ believed these voices but says they would only come when he felt overwhelmed with things that were happening in his life, or if he felt his life was at risk or threat of harm was imminent. So, JJ dropped out of therapy at session 13 after the incident involving the assault against the police. And about 2 weeks prior to the incident with the police, JJ stated that in his session with the therapist that he was beginning to see some progress in terms of how he managed his emotions when he thought about past events and could imagine a time when he would feel like he has some control over what happens to him. Of course, no, the breakup with the girlfriend a week later resulted in feeling as if he needed to resort back to maladaptive coping behaviors. Kasi in previous, JJ stated that when he felt stressed, he would escape in his mind and try to shut everything out. And then he reported that he would become stressed out and unable to shut out negative voices in his head. As well as escape from overwhelming feelings over his demise. So JJ reported hearing voices in the past and that these had resulted in suicidal attempts and violent outbursts. So, after 10 session ni JJ dito, no, sinabi niya na tawag dito, nakakarinig na siya ng voices na para bang ang sinasabi nito is worthless siya, pangit siya, and also didn't deserve to live. Wala na siyang karapatan mabuhay. Yun yung naririnig niyang voices. So, basta dito, sa slide na to is, ang ina-emphasize lang naman dito is the voices na naririnig niya is ang sinasabi is to kill himself and that everything would be okay if he was dead. Also dito, he attempted that suicide at least 3 times na in the past 18 months because he felt like he just couldn't take it anymore. Okay? So, next is JJ had previously indicated that he knew the police was looking for him, for a probation violation involving his mother, and that death by cop seems like a good action to take, na at least that is what the voices in his head advise him. So death by cop is often described as an individual recognizing that if he waves a gun at the police officer or demonstrates behavior that could be particularly threatening to a police officer, so it is highly likely that the person will be shot by the police. So JJ believed if he attacks a police officer while in the act of stealing a car, for sure he would be shot and killed. So since his suicide attempts has not worked, he believed this would be the only way to assure his death. So nung nalaman ni JJ na hinahanap siya ng mga pulis for a probation violation involving his mother, seems like a good action, no? Kumbaga para sa kanya, yun ang maganda, o yun yung good action sa kanya to take, dahil yun ang sinasabi ng mga voices na naririnig niya through his head. So, dahil dito, ang paniniwala ni JJ is kapag daw he attack a police officer habang nagnanakaw siya ng kotse, for sure, he would be shot at mamamatay siya. So, since hindi nag-work ang pag-suicide attempt niya, naniniwala siya na yun lang ang tanging paraan para ma-assure niya na mamamatay talaga siya in that way. So, dumako naman tayo sa theoretical integration. So, JJ has had a range of diagnosis from childhood PTSD, major depression, ADHD, ODD, schizophrenia, and most recently PTSD with psychotic features. So, after a full review of his psychological experiences, although the last noted diagnosis for JJ was PTSD with psychotic features, upon further clinical assessment and review of the current diagnosis literature, the more probable pala na diagnosis for JJ as the CPTSD or the Complex Post-Trauma Stress Disorder by Herman 1992. So, JJ's symptoms particularly reflected issues of negative self-image, significant problems with emotions, dysregulation, risky behaviors, and some personality disturbances along with the traditional indicators of PTSD by Herman 1992. So, pag sinabi nating theoretical integration, no, ito yung kumbaga nagko-combine na ideas from multiple frameworks to create a more comprehensive understanding or approach to clinical practice. Although kanina is na-diagnose siya ng meron siyang PTSD, ang most probable pala na diagnose kay JJ is the CPTSD or the Complex Post-Traumatic Stress Disorder. So, last one is the JJ case has great utility for the application of narrative theory in the context of narrative therapy as an appropriate intervention approach because JJ is able to view his trauma experiences as something that he can now reauthor and have greater control over how he experiences his trauma. With the help of the therapies, he is guided through an emotional and cognitively safe deconstruction of his trauma experiences. So, yung case kasi ni JJ is applicable talaga siya sa narrative therapy because this is an appropriate intervention approach because JJ is able to view his trauma and also he can reauthor and have greater control over how he experiences his trauma. So, yun lamang ang akin report at sana tawag dito nanood kayo at tinapos nyo itong video na to and thank you for watching and have a great day everyone.